Hello and welcome. Thank you so much for joining us today. This is another Facebook Live update regarding COVID-19 right here in Berrien County. My name is Jillian Conrad. I'm with the Berrien County Health Department. Today I am joined by Nicki Britten, our health officer here at the Berrien County Health Department, as well as Dr. Loren Hamel, the president of Spectrum Health Lakeland, our hospital partner. Thank you so much for being here, both of you. And we will just go ahead and jump in, same as we always begin these updates, just with a rundown on how we're doing with our COVID-19 case numbers and percent of positive tests and hospitalizations. So Nicki, please kick us off with what do we need to know about where we're at right now?
Yeah, well, I'm pleased to report that we're continuing to see encouraging numbers in the COVID-19 data of just incidence of new cases and percent positivity. As we've said over the last couple of weeks, we've been flat, somewhat declining. We're seeing that slight decline continue this week. So we're between 25 and 30 new cases per day on average, which is remarkable improvement compared to where we have been in a very manageable place for us to be right now. As you can recall, one of the goals with our COVID-19 transmission is to make sure that we don't ever get to a situation where the healthcare system is overwhelmed and unable to provide high quality healthcare for all healthcare needs, COVID and non-COVID. And we're in great shape right now. The percent positivity is about 7%, again, market improvement. I know the numbers in the hospital are lower or flat at a more comfortable level. Of course, we don't want anyone hospitalized from this, but it's definitely at a manageable level. So from a data standpoint, all of that is feeling really good right now. Now, some of this might just be part of my personality, but when things are going good, that's when I'm always waiting for the other shoe to drop. So I don't want us to be in a situation where we get too comfortable and we stop doing the things that matter the most, especially when we have some variants. We heard earlier this week, there was a press release that went out from our neighbors from the Cass Van Buren Health Department that they had identified this UK variant strain of the virus. We know it's been seen in Washtenaw County. It's been seen in states all over the country. We have every reason to believe it's probably here in Berrien County. We just haven't identified it yet through the special testing that would identify that strain. And the thing that is just important to keep in mind and why we can't let our guard down is that strain of the virus is just more infectious. It's more likely to spread between people than what we were seeing throughout much of last year. So while our numbers look good, and that is a testament to what our community has been doing in terms of social distancing and masking and avoiding large crowds and good hand hygiene, all of those right things, we have to continue to be vigilant, especially as these variants are really changing the landscape.
Dr. Hamel, can you give us some updates on how things are going there at the hospital?
I certainly can. Nicki pointed out a fair amount of it. Our volumes are down in the 20s, sometimes a little below that. That is so much better than up around 80. And we're really appreciative of that. We've been able to, given those lower volumes, we've been able to liberalize some our visitation policies. That's been so helpful. We still are not allowing family into COVID units because of the risk to the family members, but trying to make sure there are video connections to those folks. But we're allowing 2 visitors, way more places than we were able to. A few places still one, like surgery and outpatient settings, but in many of the inpatient settings, we're allowing 2 visitors. We have seen the positivity rate go down, as Nicki said, and that is so reassuring. But I just want to remind folks, we still are caring for really sick people. And not all of those sick people are just the elderly. We have had folks in their 30s and 40s on prolonged ventilator assistance. And so, be diligent. We still don't want you in the hospital. We don't want you to get sick. That's why being so careful. And that's why electing to get a vaccine when you're able is so important.
Absolutely. And Nicki, could you just comment, is the health department still doing case investigation and contact tracing? How are those things going?
Yeah, we absolutely are. So in 2020, so much of what we talked about was case investigation and contact tracing. And those remain really, really important tools. And we do have dedicated human resources to doing that task every day of the week. And so that still remains a really, really important tool for stamping out lines of transmission and making sure people know when they've been exposed so that they don't continue to expose others if they are indeed infected. So we still have team members dedicated to that task. Isolation and quarantine remain useful tools. I know that, here we are 11 months in, they're getting real annoying. But if you need to be quarantined, it is still for the benefit of the public's health. And especially at the point where we are now with the potential for seeing higher transmission with variant strains, if and when that is happening here, quarantine and isolation still are our quickest tool. That is what allows us to be most agile in shutting down transmission. As I've said before, the vaccine, that's a long-term investment. It's really good that we're investing in that right now. It will pay dividends months from now. Isolation and quarantine are other tools in addition to the social distancing, the masking, washing hands that still remain very important.
So good to know that we have all of those tools at our disposal, and they definitely seem to be working here in Berrien County. So let's talk about that newest tool, the vaccines. There has been some really exciting, encouraging work that has happened in Berrien County over the last 5 to 6 weeks since vaccination rollout began at the end of 2020. Can you just both share with us what are the latest updates and where are we at with those efforts to vaccinate our community members? Nicki, can you just give us a review of what are our goals for vaccination to start out with?
Right. It's always good to root ourselves in the goals so that we understand why we're doing what we're doing. And so we have 3 main goals. One, just like with disease transmission, what we focused last year, we want to prevent overwhelm at the health system. So we're doing good in that regard right now. But we also want to decrease the number of deaths and severe outcomes for people. So those most at risk of severe outcomes, we want to vaccinate them and make sure they're protected. And we also want to maintain certain essential critical infrastructure and societal services. This is not all essential workers, workplaces yet, because there is an ordering of those of who's eligible, but maintaining certain infrastructure. So protecting the vulnerable, protecting the healthcare system, and protecting critical services. Those are our main goals. And to that end, we have a multi-pronged approach in how we're trying to do this. And between Spectrum Health Lakeland and the health department, we have a bit of a portfolio of different ways in which we're doing vaccination. We're doing some large scale mass vaccination where we're doing 1,000+ doses per day. That's something that both of us have been doing. I don't know, Loren, if you want to talk a little bit about that.
No, that's working pretty well, but I'll have some comments here when you're done about vaccination.
We've got the large scale approach that both of our organizations are doing. The health department has also done some drive-through sites too, so that people have an opportunity where they can get the vaccine without getting out of their car. And that has allowed us to be in a variety of places throughout the county. We also have some pop-up clinics, and these are really intended to help get at a very vulnerable population, people who might have more barriers to accessing, say, a mass clinic strategy. That doesn't work to get the entire population. So we've done pop-up clinics and have more planned at senior centers, community locations, churches. They're a little bit smaller scale and they're targeted with the outreach there, but definitely an important piece of the strategy. And then we're also doing some on-site vaccination in places. We have a nursing home, some adult foster cares. We have homebound individuals where we're actually trying to go physically to where the people live to make sure that we're getting the most vulnerable in terms of disease risk, but then also in terms of access. So we need to have this broad strategy to fit our community. We can't have a one size fits all for vaccination. Everybody's got different entry points and different barriers, and we're really working to make sure we have a really robust complement of strategies.
Dr. Hamel, would you like to comment on Lakeland's contributions to that strategy?
I just like to call out the health department that the DriveUp Vaccination program. I have heard so many good things about that. You wondered why you needed that huge parking lot. Now it's come in to be such a blessing. It really has been a great program. Yeah, we often get asked this question. You know, I'm taking chemotherapy. I'm sick with lung disease. I've got, immune compromises. Why on earth don't I get the vaccine earlier? And I can tell you, as a clinician, it really breaks my heart that I can't say, oh, absolutely, we're going to put you at the front of the line. But there's a reason, and I might draw this comparison. When the federal government is in charge, they're buying the vaccine and they're doling it out to states, and of course, states are doling it out to counties and health systems. It's a bit like the COVID stimulus checks. Everybody's getting those below a certain income level, and it's not how much money you have in the bank. It's not how far you are behind your rent. They have to use these broad tools to make these programs work, to make them efficient. And they've selected 2 criteria that, seem to make some sense. Are you in an area where it's a critical service that we have to maintain? And are you below or above a certain age? Now, those aren't perfect tools. They don't include every disease. They don't include every condition. We get that, but you have to start someplace. And that's where the experts have decided to start. And the folks that are paying for the vaccine and sending it out to the rest of us to administer. So we're really not in a position to say, oh, disregard all of that. We're going to make our own list. What you're asking, those questions they're completely legitimate, but we really are limited in our ability to kind of rearrange those criteria. I also so much appreciate what the health department is doing is to make sure within those criteria, they're getting to the people in the community at the highest risk for getting sick, at the highest risk for dying, the highest risk for needing hospital admission. So we're trying to do that as we're administering within those wide age ranges. But that's about as granular as we can get right now.
And I think it's worth noting, because we hear a lot of these inquiries as well. And I share your heart, Dr. Hamel, where it's just like, yes, I really want to vaccinate you right now. And I understand for those that have underlying conditions but don't meet the age criteria. But it's important to also remember, when we think about public health, having more people vaccinated also does protect the vulnerable.
Everybody.
So as more and more people are getting vaccinated, that does increase the just amount of immunity in our community, and that does help stamp out lines of transmission, make it less likely for viral transmission to occur. So while we are somewhat beholden to these guidelines that have come down from the federal government about how to administer it, there is growing protection in our community as we move through those.
Good point.
That's excellent. And we know that to date, combined efforts from the health department and Lakeland, as well as many pharmacies in our area that were doing vaccinations at long-term care facilities, there's been more than 20,000 first and second doses combined that have been given out here in Berrien County, which is very encouraging. And Nicki, can you comment on some of those newest groups that we've been able to provide vaccinations for, even just starting this week?
Yeah, so this week we were able to move into more of the currently eligible essential workers, and we've started holding some educator clinics. These really function as what we refer to in public health as closed pods. So it's really geared towards a specific population. We've been working with the schools to be able to get staff vaccinated. So we have some more of those closed pods for school staff that are scheduled, and we're working to get through the school staff that said, yes, I'd like a vaccine. It's not 100%, but it is relatively high, and we're working to make sure that they get vaccinated. We're working to do the same with childcare providers, and then there's some other frontline workers at our local county office of DHHS that we're working through as well.
Excellent. But we still know our reality is that we have far more demand for the vaccine than is being supplied to us. Nicki, can you walk us through how are these allocations being made? How are we supposed to know how much vaccine we're getting week to week? Can you tell us more about that?
Absolutely. And it can be a little bit of a mystery, or just wondering how that's happening if you're looking from the outside. So essentially, the CDC is responsible for making allocations of vaccine to the states, but then also to some federal contracts that are in place. So we heard last week about a federal contract with pharmacies. That's an allocation. Every state is getting an allocation. And these allocations are based primarily to the states, are based on population. So once each state has their allocation, the state of Michigan is told you're getting X number of Pfizer doses, X number of Moderna doses. The state then has the job of allocating it to the providers that are giving vaccine right now in the state. So there's actually a formula that they have. I don't know all of the details of it, but there's a formula that's based on population in the county, but it's not the whole county population. It's the population of the eligible or people eligible for vaccination currently. So it depends on our population of 65 plus, as well as the number of essential workers we have in our county that are currently eligible for vaccination. So every county has that. And then within the county, there's a little bit of a divide, and it's not perfect at the local level, but at the state level, then there's a split between how much vaccine, what percentage is going to health systems and what percentage is going to health departments. As we have more providers come online, like more pharmacies, and that becomes more consistent, those entities will be part of that as well. So we as the health department don't say, we think we can do 1,000 doses this week, give us 1,000 and then we automatically get it. If that were the case, I can assure you we'd be getting at least 7,000 doses of vaccine into our county every week. If it was just ask for whatever you could use and you would get it. We could use a lot more than we're currently getting. So as those allocations ramp up, as production of the vaccines, that's really the limiting factor. The vaccines just need to be produced more rapidly because they're all just getting out immediately. So once that vaccine production ramps up, then the allocations go up, and then we're able to get them to more people each week than we currently are. So us making requests, we don't even get or do requests anymore. It's all just a set number is just sent to us of our first doses, and then the second doses follow behind at the time that we need them. So there's a lot of logistics that makes that whole system work, but so far it's working pretty well. We just need more vaccine to be produced.
Yeah, absolutely. And we know that there's a lot of folks out there who have been waiting very patiently for their dose. Can you just remind us, and for our audience today, if folks have not indicated their interest in receiving a vaccine, how might they do that? Dr. Hamel, can they do that through Lakeland somehow?
They can do that through MyChart. If they're one of our patients that have signed up for MyChart, that is the easiest way to get on the list. And once you've done that, you're on the list. You don't have to do that twice.
And Nicki, same for the health department?
Yes, you don't need to do multiple submissions, but we do have a link on our website as to where you can sign up. If you're on the list, you're on the list. You don't need to submit it again. But if you've signed up in MyChart and you want to sign up for the health department, that's fine. You can be on multiple lists. Maybe you're on a list with Meijer. I think there's some other pharmacies that are starting to collect information as well. That's okay. You can be on multiple lists. We're just going to ask that once it comes to an appointment time, you have a day and a time to come receive your shot. We don't want you to have more than one of those.
Excellent. And we do know, speaking of Meijer, that there are other entities within our community, specifically some of those retail pharmacies that are now offering vaccinations. Can you tell us more about that federal retail partnership with the pharmacies, and what might we be able to expect here in Berrien County?
Yeah, those are some really good questions, Jillian, some of which we're still awaiting some answers on. So we do know that there has been, in the state of Michigan, there's been a pilot program with Meijer. So Michigan is giving Meijer some vaccine, and they have stores in, I think, 4 counties. Ours is one of them. So the Benton Harbor Meijer is participating, but it's a pilot project to get Meijers on board to start giving that vaccine. So I think this is the 3rd week that the Benton Harbor Meijer has been administering vaccine. So you can, if you visit the Meijer website or your MPerks app or visit the store, there's lots of ways to be able to get on that list if you so choose. There have been some other very small amounts of vaccine that have made it into some Walgreens in our area. And a lot of that has been through a partnership with a certain health system on the east side of the state that has patients identified, and they've been trying to work through some of that. So it's not consistently available at any other retail pharmacies, although many of the other retail pharmacies are gearing up and preparing for when they do get vaccine allocation. So I think there's a lot of different lists that people could get on, to try to hedge their bets as to where they can get a vaccine first. But lots of options out there. The federal program of direct distribution of vaccines, that we were told that some of the initial doses might be shipped out today, and each of those pharmacies, the pharmacy chains, are handling it a little bit different. We know Rite Aid is trying to spread it to a very small amount to all of their stores. Meijer is doing a more modest amount to a fewer stores. So there's some different strategy in there. So it's hard. All of this we expect to evolve over time as well.
Certainly, this is a constantly evolving situation. I think we are all well aware of that fact. So there are lots of different options as far as places you could go for the vaccine. But at this point, as it stands, there are still only two vaccines that have been approved for emergency use here in the United States. Dr. Hamel, when people go to make their appointment, are they able to choose which product, either Pfizer or Moderna? Which one's better?
I can tell you, as providers, we can't choose, and we can't do this in a way where you can choose. We're just grateful when we get a dose, and we're grateful when we're able to put a dose in your arm. It appears that there really is no significant difference in the efficacy of the vaccines. When we get the Johnson & Johnson vaccine, it's a little different in that it's a 1 dose instead of a 2 dose, and that may alter some on who qualifies for that dose, but we don't have that yet, and we certainly will share more about it when that dose arrives or when that vaccine arrives. But at this point, no, there's not a choice.
All right. So Nicki had mentioned earlier about some of these new variants of COVID-19, mutations of the virus that we're starting to see globally, but also here domestically, and even in our own backyard here in Southwest Michigan. Dr. Hamel, can you tell us what else do we know about these variants, and do the vaccines that we have available seem to be protective against these variants?
Well, I think 2 or 3 things are at least currently believed about those variants. Most of those variants appear not to be much more severe, but a little more contagious, some of them. There are some variants that are fairly well described and where we kind of know where they're spreading. There are folks that estimate there are actually thousands of variants, which occurs maybe 4,000 or more, which occurs probably with any pandemic. We just have the resources to track it a little better with this pandemic. But at this point, we don't have too much evidence that here is one that is markedly more dangerous. Having said that, the longer a virus is in an active pandemic stage, the more likely we are going to get mutations, the more likely these variants could be more severe. And so we're in a bit of a race to make sure we get either herd immunity through infection, which we don't want, or through vaccination, which we clearly want. That would be so much better. And the other thing that most folks are believing, and in fact the pharmaceutical companies are gearing up for, is very likely is going to turn into an annual booster. That hasn't been decided yet, but we think it's probably heading that direction. We're used to that with flu vaccines, obviously, and that likely will transpire with COVID-19 as well.
Excellent. So much great information today. Before we close, any last parting thoughts? Nicki, we'll start with you.
I think we're in this messy middle period that we were talking about towards the end of last year, where things are just changing constantly. And it's now that I've been vaccinated, should I wear my mask? The answer is yes, you still need to wear your mask out in public. Or, how do I get the vaccine? There's lots of questions out there. I would just say there's lots of good information on the health department website. There's lots of good information on the Spectrum website. We know this is a messy time. We're here to try to answer your questions.
Absolutely. Dr. Hamel, anything to add?
Yeah, a comment or two. Be patient. We're probably in this vaccination stage for all of 2021, or most of it, and it may go beyond 21, but this is not a short game, so be patient. Number 2, be careful. It's not over yet, and lives are still at risk. Help your friends and loved ones be diligent as well. You can protect their lives and their safety by encouraging them to be very diligent. And I hope for all of you that you stay well.
Excellent. I would agree with that. Be patient and be careful and ask the questions that you might have if you're catching this live or whether you're watching the replay. We are here for you and we are happy to answer your questions. You can find great resources through the health department's website or Spectrum Health Lakeland as well. Ask your questions. We're happy to answer them. And we thank you so much for joining us today. We will be back at another time in the future with more updates as they are available. Thank you so much for joining us and be well.